everyone. Thank you so much for joining me again. For some of you, this may be your first time with me. I'm Lynn Mackey. I'm so happy to be with you today to walk you through some things about service delivery. And my goal here today really is to help you get some clues and some support in developing um, great quality programming that won't wear you out, that won't lead to burnout and compassion fatigue for you. All right? Here we go. We're going to discuss the benefits of intentional planning and design. Why would we do that? Why would that help us? I've kind of let the cat out of the bag a little bit already by saying that we want to help you design quality programming for students, but also we want to help you as liaisons. We want you to not be burnt out. We're going to talk about the difference between high touch versus low touch services. I've designed a service delivery planning tool for you, and we're going to work together on that. I've already made it a PDF, but I'm going to ask that you consider some other questions, some other things that came to mind for you as we go through the service delivery planning tool. And then if you come up with some other questions that should be added to it, then I will revise that tool and make it available on our site. All right. We're going to talk about opt-in versus opt-out services, explain what those are and the differences between them. We're going to talk about data collection for opt-out services and understanding that data collection is a big part of what you do as liaisons. And then we're going to have a question and answer period. Of course, as Brittany said, if there are questions that you have and things you want to put in the chat as we go along, please feel free to do that. The benefits of intentional planning and design. Why would we want to do that? Well, of course, we need students to have quality essential services delivered, okay? And we want that to be done in a way that is scalable and in a way that is done efficiently so that you are not using all of your time doing one kind of service delivery that takes a lot of your time and energy. There's some different ways to design programming that can still give students what they need, but also give you what you need as a liaison, especially if you are a one-person office. I want to be mindful of those of you who are in that situation. All right. Really, for optimal results, you want to mix high touch and low touch services and opt in and opt out services. So we'll talk a little bit about how to do that, how you have been doing that already, some of you, and we'll work together on just sharing some tips about how to get that done a little bit better. All right, high touch versus low touch services. Okay, what's the difference here between these kinds of services? So high touch services are the ones that I say we really love. They are the services where we provide them in a one-on-one format with students, direct interaction with students who need more intensive personalized support. And sometimes that may involve short and long-term goal setting to help meet students' needs if you're in a coaching sort of situation. So examples here are mental health counseling sessions. Those are individualized. Initial basic needs consultations when you first meet with students and they first disclose that they need some support with basic needs. You're sitting down with them, you're spending a lot of time with them to get an understanding of what it is they need and what their situation is. Of course, individualized coaching sessions, these may be along the lines of budgeting and financial management, maybe things that require them to set some short-term and long-term goals. And then emergency assistance appointments. Oftentimes when students have an emergency need for rent, childcare, transportation, those kinds of things. Usually we're sitting down with them to talk to them about that need. So these are high touch services. These are the services that are going to require your one-on-one individualized attention and focus. We love doing high touch service work because we get to know students, we get to connect with them, they get to connect with us and build a relationship with us in our office. It's fantastic. But I want us to consider some other ways of delivering services because high touch can burn you out very quickly. Again, especially if you are a one-person office. All right. So, what are low touch services? These are services that are delivered to students usually in a group setting, or they're leveraging technology to help you deliver the service, or there's some sort of standardized process that allows for delivery of services. I'm thinking about student orientation programs, which I've had a lot of experience with in the past. Those are services where there's a big group of first-time students coming in, and there is oftentimes a standardized program for orientation. Oftentimes it's on the computer. Students go through a whole bunch with the technology, and then there are times when practitioners are speaking to them, et cetera. Students learn about universal broad topics during low touch services. They are building skills. For example, in a first year experience course, first year success course, they're skill building as well. And they're doing things systematically. There's been a process that's already been determined about how these services are going to be delivered. So more examples, workshops, all right? Workshops on completing the FAFSA, how to conduct a housing search, how to conduct an employment search, those kinds of things. And then nudging is a low touch service. And this is just a reminder that may be done automatically through an automated service, through the use of technology, reminding students it's time to complete your FAFSA, renewal FAFSA. It's time to we're offering, the food pantry is open during these hours. So that's nudging and reminders. All right. Time for discussion. I would love to hear from you all what some of your high and low touch services are at your institutions. Just want to make sure that we're all on the same page about what kinds of services we're talking about here when we say high touch. When we say high touch, we're talking about those services that are one-on-one interactions with students. We deliver them that way. When we're talking low touch, usually it's in a group setting, workshops, orientation, first year experience courses. Please share with me in the chat or unmute yourself and let me know what are some of the high touch and low touch services you all have at your institutions. 17 of us on the line today. Thanks everybody for joining, those who are just coming in.
Hi, this is Crystal with IVCC. I can share something from our institution. I'm no longer the house liaison, more of the backup house liaison, because I have a new department under me. So they handle more of the day-to-day. There's two of them. So as far as something that would be more of a low touch is they send targeted emails out to students that fall into that special populations group to let them know about different resources that are available. And then going over to high touch, they do have one-on-one appointments with students, connecting them to resources that they need in the community or helping them finish their single stop screening to see what other federal or state benefits that they might qualify for.
Fantastic. Thank you so much, Crystal. Allison says for high touch success coaching, yep, new student orientation, low touch, yes. Workshops, text reminders, encouragement. Fantastic. Yes. All right. Thank you, Allison. Anyone else?
I can speak.
Okay.
We have started a new intake process for the students that are coming to the food pantry. So we have recently opened a new revised enhanced food pantry. And
Mm,
so we also are having them do an intake about housing, health insurance, health needs, mental health needs, financial support. And so then the low touches, then I'm following up with an email to say, hey, just so you're aware, we have these other resources. Take a look at our
mhm.
portal, take a look at those things if you need any more support. So that's what would consider kind of a newer low touch that we've been doing.
Fantastic. Thank you, Teresa. Jenna says for low touch, first year experience. Yep. Orientation classes, financial literacy workshops. Yep. Citation academic workshops in the library. Yay. Glad to hear about the library. Fantastic. High touch navigators to assist with barriers outside of the classroom. Yes. Academic retention coach. Yes. And success coach. Fantastic for high touch services. Allison says we use cohorted outreach as well. And Wally chimes in and says, I am a student wellness specialist. I meet with any student one-on-one if they're asking for information. Yep, so that's your high touch resources to meet their needs. Fantastic. You all are doing great work out there. Thank you for sharing. All right, let's move on. What else do we have here? All right, so as I was saying earlier, you really do want to have a mix of both high and low touch services to avoid compassion fatigue and burnout. Really, those services are meant to complement each other, and you all are already doing that very well. I'm so glad to hear that. One thing I wanted to point out too is that low touch services can help identify students in need of high touch services. So, for example, if you have that financial literacy workshop that one of you mentioned, maybe that financial literacy workshop has a self-assessment that students complete at the end of the workshop, and they'll let you know through that, well, I might need some individualized help with my finances to help me live independently. I'm going to have my own place. I need to learn how to really manage my money well, make it last throughout the month so I can pay rent and those sorts of things. So keep that in mind as well. And so when you think about combining high touch and low touch services and mixing them, you really have to think about the services that you already provide at your institution, what the culture of your institution is like, and what it's going to bear, and then the resources that you have at your disposal. I heard someone mention Single Stop, which is a technology that they can leverage to do some of the work that the liaisons do in terms of reaching out to students and nudging and some of that electronic support, which is very helpful. Some of you do not have those kinds of resources, and so you have to design and plan accordingly based on what you've got to work with. So. Um, Another thing, again, you are important, you matter. And so we want to make sure that you are designing and planning the delivery of services in a way that also supports you, that also supports and keeps in mind and takes into account the amount of time that you have, the amount of staffing that you have, the resources, the other resources that you have, the funding that you have. We want to make sure that you are taking care of yourself. Okay, so let's think this through together. Um, as I've said, we want to mix these two kinds of services and maybe think outside of the box and think a little bit differently. Can you think of a high touch service that, of course, provides quality care? We know we love our high touch services, but is there a way that we can kind of turn a high touch service into a low touch service or a lower touch service? One of the things that I'm thinking about, I think one of you mentioned emergency assistance or emergency assistance appointments, and I mentioned them earlier. I'm thinking about maybe if there is a student that you already have, um, you're already doing high touch services with that student, maybe through counseling or by some other means. And then that student has an emergency assistance need. And that student who already has contact with you through other high needs, high touch services, can that student maybe complete the emergency assistance application online and then have it processed that way, since you don't really need to sit down with them and go through this and that? That would maybe reduce the amount of time that you had to spend on offering that particular service. So that's kind of one way to think about how high touch services maybe can be delivered in a low touch delivery model, or we can reduce the amount of time that needs to be spent, and we still have a quality service. Can you all think of those kinds of hacks, if you want to call them that? Some shortcuts that still deliver great quality service, deliver just what the students need, but it takes a little less time, a little less energy from you and those that you're working with. Anyone? Calvin says, would an online mental health service like Timely Care be an example? Calvin, can you explain what Timely Care is like?
Yeah, so Timely Care is a mental health and wellness model
Hmm.
module, an app that we've purchased for our
Mm.
campus.
Hmm.
Students, aside from now going to our counseling services, can also request a 30-minute session within and be responded to within 10 minutes, as well as
Hmm.
do some online coaching, access to a general community of discussion boards, as well as articles and videos around everything from like basic nutrition and working out to how to deal with stress and anxiety.
Yes, Calvin. That's an excellent example. Excellent example. So students have access to these other mental health and wellness resources through the app that a practitioner doesn't have to sit and give them all of that information. They can do that. That's in a self-service sort of model. Excellent, excellent. Thank you so much. Claire says, I schedule text messages to students, both those that advise for academics and those that I've worked with for housing benefits, et cetera, to check in and see if they need to meet. Not sure if this is what you mean. Yeah, that's along the lines, Claire, because um, that's reducing some of the time of what you would have to do um, in person, or on the phone, if it's a quick text message as opposed to a longer, more in-depth interaction. That's helpful. Okay, very good. Fantastic. All right, you all. Thank you so much for that. Let's see what else we have. All right, so now we're in the throes of planning. What I've done is I took from the California Basic Needs Toolkit. That is, there's a link to it in my resources later on in the slide deck. I've taken these first 6 questions from that resource around planning, planning mostly high needs versus low needs. It gives you some questions to sit and think about and consider. If you have a team of folks that you're working with on the liaison duties and providing basic needs for students, then please take this planning tool, these questions, and think through them with your team. If you don't have a team to think through these things with, please identify yourself in the chat. And I'm going to ask that someone else who maybe is also a one-person operation would join with you, and you all could become thought partners and maybe have some Zoom meetings together to really think about how to plan out your services to get a mix of high touch and low touch together there. So I'm going to go through these questions with you all. As I go through them, if there are other questions around that would help with planning and designing service delivery, please put those in the chat, because what I'll do is I'll take those additional questions that you all, and Brittany, if you could help me gather those questions too, if they come up. I'll take those additional questions and I will add them to the planning tool that I already have. I've already got, I think it's 12 questions that I'm going to go through with you here today on a PDF. I'll just add to those and make those available to you on our website so that you'll have something to think about, how to do this mix of high touch and low touch services. Wally says we have Campus Talk app. It is also a mental health support system, but it is peer-to-peer oriented. So students can use each other as resources. Love that. They can get time with a professional, also fantastic. Thank you so much, Wally. Great example. All right, planning. Again, we're gonna see if you all have some additional planning questions that would help with this effort because being so close to the work, being boots on the ground, doing everything every day, you're going to have a different perspective than I've had or that was presented in the California toolkit as well. Okay. Which services can be delivered to a group? Really have to think about that. Obviously, food pantry events, workshops, and whatnot, those things can be delivered to a group. So you want to think of those and put those in your low touch bag. Which services have to be delivered one-on-one? And again, we're going to think about this more broadly because you all have provided some great examples for how one-on-one service delivery and that high touch service delivery can be at least supplemented by some low touch efforts, all right? How one-on-one personal counseling can be supplemented by technology and the apps, okay? How will you structure high touch services? So you got to think it all the way through. How many coaching sessions are you going to offer? Is there going to be a cutoff at some point? Is there going to be referring students to an outside resource at some point? If so, at what point is that going to happen? Specified path for screening and accessing benefits. Got to plan all of that out. What's the follow-up going to look like? Another thing that you'll have to think through. How will you ensure that students who stand to benefit the most from high touch services are actually accessing them? That is a tough one and something that you'll have to think through and you're never going to be able to stop thinking about that, as you know. Again, if you need a thought partner, please identify yourself in the chat. Try to connect with someone who can help you think through these things and get some additional ideas. How will you use data to track the effectiveness of your services? That is a big part of what you'll need to do in the role as liaison because we're looking for you to report on your data and how will you use data to identify gaps or problems with your services? You want that information so that you can help improve those services and so that they are more and more effective and more efficient. All right. What do we have in the chat about this so far? Teresa says food pantry, open house, open presentation and library, defining homelessness and supports provided. Yes. Video presentation was sent to all faculty and staff. Fantastic. So now the whole campus knows. Everybody knows what's going on, and there was an open house. Everybody had an opportunity to see what was going on there with that low touch event. Fantastic. All right. Anyone else from this first one? We've got another slide to go about 6 questions. If any questions pop up for you as we go through this, things that you need to consider as you're planning your service delivery, please pop that in the chat and I'll add that to this list of questions. Okay, let's see what else we have. All right. What services just make more sense to offer in the low touch delivery model? We know what those are. The food pantry, of course, that's a low touch delivery service. And so you just put that in the low touch side, and that's one less thing that you have to do high touch. Consider how many staff members and our folks are on your team. Is there a way to increase staffing in some sort of creative way? Student employees, hiring them, or volunteers, or student ambassadors. Cross-college collaborations, that's another way to try to increase staffing. For example, There are other offices that offer financial literacy workshops, maybe the financial aid office or the TRIO Student Support Services office or the Multicultural Student Affairs office. They do some of the same things and offer students some of the same information that you may be offering them through a counseling center as a liaison, for example. Can you collaborate with them and increase your staffing and your resources in that way? What kind of funding is available? Are there grants out there that you can apply for? Hopefully, you have the folks who are supportive of you going after those so that you can get some more funding for students and some more resources and support. Can you bring some technology on board? You all have talked about some fantastic apps, including what is it, Single Stop and some others. You mentioned some mental health apps as well. Are those within your budget? Can you find the budget somehow to bring some of those apps on board to do some of the work for you? And then automated assistants, oftentimes they're able to do things 24 hours a day and answer students' frequently asked questions. So it would be great if you can employ some of those tools. Wally says work study students that way students get jobs, yes, that work around their schedule and the funds don't come from your department. Brilliant. Yes, Wally, that's why we love the work study program. Absolutely. Give students some great skills that they can use in the job market later on down the road. And they're working and they're earning and getting experience. And the money does not come from your department. Fantastic. Any questions that come to mind for you all as you um, review these questions about planning? Um, Surely you all have had to sit down with your teams or sit down by yourself and think about some of these things and think through some of these things and figure some of this out. Anyone, any questions or anything that comes up for you? Okay, what are the differences here? So opt-in services are those that require the student to complete an application, to fill out a form in order to enroll in the service. The default is that the student will not receive the service. They absolutely must identify themselves, identify their need for the service, seek out the service or program or opportunity, and initiate enrollment. Otherwise, they will not be able to receive that service. So obviously you're thinking immediately about financial aid, right? Students have to complete the FAFSA in order to receive financial aid award. If they don't complete the FAFSA, they will not receive financial aid. Um, Mental health counseling have to come and identify in some way that they are in need of that service. Otherwise, they won't receive it. Public benefits are the same way. Okay, those are all opt-in services. There are great data collection benefits with opt-in services. We'll talk about that a little bit later. But those are your opt-in services. And there are some disadvantages to opt-in services. We'll talk about that as well. Opt-out services. These are the services that don't require students to take action to enroll. They are automatically included. And if they don't wish to participate, they may opt out. But everyone is included from the beginning. And so there's nothing that they need to do to be able to receive that service. And you have some examples here. Food pantries that are available to everyone in the campus community. And free breakfast for everyone, all students, sometimes staff as well. Um, an e-newsletter that is automatically sent to all students about basic needs resources that are available to everyone. Those are opt-out services. You're all automatically included in the service, and you will receive the service unless you opt out and decide that you do not want to receive that particular service. All right, let's talk about opt-in, opt-out, at your institutions. I would particularly love to hear about some of the opt-out services that are available to everyone in the campus community. I love those because it makes students feel included. Oftentimes they may feel ashamed of needing services, and so they won't approach the office and let anyone know what they need help with. But if there's this great opt-out service where everybody's welcome and everybody's there and everybody is availing themselves to the service, then they're more likely to get what they need and more likely to participate. So I love those. Examples, please, in the chat or unmute yourself. I want to hear about your opt-in and opt-out services. Let's see, Calvin says food pantry. Yep. Counseling, opt-in, financial aid, in-person support, yep. Academic support, in-person support, and career clothing closet. Okay, I love that. Career clothing. Calvin, everyone has access to the career clothing, the career clothing closet. That's an opt-out.
Correct. So every student is allowed to get one full suit or equivalent
Mm,
during their time year, and each year they can get one blouse or shirt or a pair of slacks. And every student has that availability.
mm-hmm,
Not every student, of course, takes advantage of that.
mm-hmm, mm-hmm,
But we've had several students who have used it for other things, like making sure that they can go to game day events wearing the appropriate clothing and things like that.
mm-hmm. Oh, I love that, Calvin. Thank you. All right, let's see. Claire says our students are opted into Handshake, the career site, and food pantry. Great. The food pantry, they just have to sign in the first time. Academic support, mental health support, basic needs support. Not all take advantage of services, sure. Okay, fantastic. Thank you all. All right, let's see what else we have. Data collection from opt-in services. Of course, that is the big advantage to using opt-in services is that you have the contact information, the demographics, all of that information is on the application form, the registration form. As a part of the registration procedure, you automatically get that information. And so that information can then be used to reach out to students, to let them know about other resources, etc. Fantastic, okay? Easy peasy, no problems with that. The FAFSA collects a lot of this information that you'll need about household income and their housing status and whether they've been in care. And so then the financial aid office can use that information to reach out to students and let them know about basic needs support services. That is the great advantage of opt-in services, okay? Opt-out services, data collection is not as easy, but there are some creative ways that you can do it, and I'd like to share that with you today. Um, you may not get contact information and demographics and those kinds of things from the opt-out service data collection, but it's going to give you information about how to grow the program, how to improve the program, the most effective way to let students know about the resources that you offer. I'm going to share with you a program that was at Joliet Junior College. It was called JJC Eats. This was back in, must have been the beginning of 2022, okay? Let's talk about that. So JJC Eats was a part of the Hunger Free Campus program that was established at the college. And actually, Patty Zuccarello was the one who kicked it off. And she did it based on the SESI data that came to us about students. About 25% of the students at Joliet Junior College stated that they didn't have enough food to eat. And so they took her funds and CARES funds and came up with this program where there were poster boards and coupon boxes in 10 different spots around campus. There were clings on the bathroom mirrors, some of the bathroom mirrors, some of the windows in classrooms, and they looked like this on this picture. That's an example of the poster, and there were coupons that came along with the poster, and they were $10 coupons that students could use in the cafeteria. Whatever they wanted to eat for 10 bucks, they could grab a coupon. They could use two a day, grab two coupons, use one at breakfast, one at lunch. And it was a very, very successful program. I think there were over 9,000 meals served through the program, and I think it cost about $80,000. So, in terms of data collection, there was a little QR code. You can see it on the poster here. There was a QR code on the poster and a QR code on the coupon. And it says here in the rules for use, it tells you, you can use this $10, no cash back in the cafeteria, etc. And please take a moment to go to this QR code, to this site, and answer 5 simple questions, if you would please. And that is how data was collected from this effort. I want to share those questions with you. All right, so the first question was just, how did you hear about this program? And 60% of the students heard about it through just the posters that were up on campus. About 30% heard about it from faculty and staff, because we did let the whole campus community know what was going on with the program. But by and large, students found out about it from the posters that were on these different strategic spots around campus. Not through email as much, not through the learning management system, Canvas, online, and that way. So this information helped us understand um, how effective we were in the different ways of getting the word out to students about the program. Where on main campus would you like to pick up the coupons? And by and large, students said that the the posters near the bathroom that was closest to the cafeteria, about 40% said that that was the way that they would like to grab the coupons. And the next closest one down was 38% said that they would like for the coupons to be actually in the cafeteria. So we wanted the coupons to be in places that were most convenient for students. We also wanted to give students an option to be able to grab the coupon in a place that was more private, for those who had that as something that was important to them. Were you able to get enough food with $10? 77% said yes, $10 was enough. And then in terms of how much would be appropriate for those who said no, they said $15 would be, of course, that's better. All right. And then how many times each month would you need to be able to access this service? 46% said 5 to 10 times a month. 28% said 11 to 15 times. All right. So a whole lot. There was a lot of need. And what else should we know that would help us implement a hunger-free campus? An open-ended question here. And the responses that we got here were really about dietary considerations. So students wanted more vegan or vegetarian meals. They wanted healthier food options in the cafeteria, etc. All right. Wasn't that a fantastic program? It was not institutionalized. When the HER funds and CARE funds ran out, the program was over. But again, over 9,000 meals served, over $80,000 used, and just a fantastic program. A great way to collect data from an opt-out program. Questions about that? Anyone? Got a couple more slides here. The disadvantages of the opt-in model. So opt-in programs are going to have a lower participation rate than opt-out programs and services, because the barrier comes in when students actually have to complete an intake process. That scares some students away. They don't want to identify themselves, maybe. They're ashamed. They may be unaware of the service. They just don't know that it exists, so they don't know to come and sign up for it. Um, and they may think that the service is not for them. They may think that the service is for students who are in a worse situation than they are. They may think, well, I'm not experiencing homelessness and I'm staying on my cousin's couch. That program is for students who are living in a shelter. So those are the disadvantages of the opt-in model, and that's why the participation rates are lower in those kinds of service deliveries. Benefits of the opt-out, of course, increased rates of participation because there's no requirement to complete forms. That QR code for JJC Eats, of course, was optional, but we strongly encourage students to give us their feedback so that we can improve the program. But yeah, removing that requirement to sign up removes that barrier and leads to higher participation rates. Also, normalizing the use of service by lots and lots of people also increases access to services because students feel more comfortable because everybody's doing it. A great example of this was the City Colleges of Chicago's Healthy Fresh Market way back in the day when I worked there at Harold Washington College. I think they've changed things around a little bit now, but when I was there, the Healthy Fresh Market was our food pantry, and faculty, staff, and administrators participated in working and distributing food in the market, and faculty, staff, administrators, and students all partook in the market. We would shop there just like students would shop there. We would distribute food to ourselves just like after we distributed food to students. There were faculty members who would go through the line and receive food. There were staff members who would go through the line, administrators who would go through the line and receive food. And that normalized the service for students who were in need of and had some food insecurity. So those kinds of things I really, really love to see. I think later on they phased out the staff and administration faculty part of it, and I think now it's just for students. But to the extent that you can normalize the service and reception of the service for students, that will increase participation rates and access to the service all the more. All right. It may also uncover basic needs for students and where that may have otherwise gone unmet, that need may have otherwise gone unmet. All right, that's the end of my presentation. Do you all have any questions about anything? Any questions about data collection using opt-out or questions about planning? Any questions that I can add to the planning tool? My contact information is there on the screen. I welcome your thoughts and questions and comments at any time. Please don't hesitate to reach out to me. Thank you all for coming today. Really enjoyed talking to all of you. Thank you so much.